Hello, my name is Dr. Santosh Bangar. I am a consultant psychiatrist with a special interest in geriatric or senior citizens mental health. I have trained in UK and achieved this qualification. So let's talk about dementia today. Dementia, as you may be knowing, it's mainly a illness of older people. So people who are over 50, over 60. It's a syndrome. Now people think that dementia happens only in older people, but that's not the case. Dementia can happen in people in the 30s or in their 40s. So just merely having a bad day at work and then forgetting things does not amount to dementia, which a lot of time people feel, oh, I can't remember this, so have I got dementia or have I got Alzheimer's? So that's a very common myth. And dementia can happen in other uh, people suffering from other mental illnesses. They can have memory problems, which is sometimes called as pseudo dementia. So let's look at what are the different illnesses which can give rise to dementia. Alzheimer's disease, or sometimes called as Alzheimer's dementia, is the commonest cause. So a common question that we are usually asked is, Doctor, what is the difference between dementia and Alzheimer's? So the simple answer is, Alzheimer's disease is the commonest cause of dementia. So that is one of it. Then there are other types of dementia as well, what is called as vascular dementia. So vascular dementia can happen in people who have had stroke or have had mini stroke, or what we call as transient ischemic attacks, or TIA for short. So in those people, over a period of time they can develop. It can start suddenly after the stroke, or insidiously after the stroke has resolved. And then there is something called as a mixed dementia, so a combination of Alzheimer's and vascular dementia. So vascular as in problem with the vasculature or the blood supply. Then there are other types of dementia, what is called as Lewy body dementia, Parkinson's disease dementia, and so on and so forth. So altogether we are talking about more than 50 different types of dementias. So the common symptoms could be memory loss, so forgetting what happened few minutes ago, not remembering the conversation, or repeating themselves, telling the same story. So that can happen. So a lot of times the relative will come and tell us that डॉक्टर ये भूल जाते हैं, या कुछ 2-5 मिनट पहले हुआ या खाना खाया वो भूल जाते हैं. So that is one of the symptoms, and it is the commonest symptom of dementia. Now the long-term memory, or what we call as past memory or remote memory, that is intact for a number of years. So they will remember things from their childhood, and they are very crystal clear in their mind. So which school they went to, what job they did, or when they went out on their first holiday or family holiday. So all those things remain quite clear in their mind until later in the illness, when those things unfortunately are also forgotten. So they will not remember when they got married, or how many children they have, or what age they had their first child, and so on and so forth. So it's very disturbing and troubling for the family. Okay, so this is about the memory, the short-term memory loss. Now there are other symptoms like having difficulty holding a conversation or understanding a conversation. So while speaking you may forget certain words, or you may not remember what a particular object is called. So you may describe that in great details. So for example, some object you write with. So the person wants to say a pen, but they cannot say that word pen. So they may describe the function or the purpose of the object as opposed to the name pen. Okay. So this can happen in conversation. So they may feel embarrassed during a conversation, or have a lengthy conversation to just say a simple sentence, because they have these deficiency, or what we call as dysphasia, about the words that they want to say or use. Then some people are not able to recognize familiar people by face. So that is another symptom. Then not able to carry out routine day-to-day tasks, so what we call as activities of daily living. So because dementia is the syndrome of the whole brain, so it's not only memory but other functions of the brain are also affected. So for example, judgment, decision making, language ability, carrying out a task, and during the latter stage of illness, all the major body functions like the bladder function, the bowels, so they may become incontinent, then the mobility is affected, so walking is difficult, and feeding themselves. So that's very hard for the family to manage. So this is about the common symptoms of dementia. Now, along with these symptoms, or what we call as cognitive features, a lot of behavioral problems also happen. So for example, people can get depression, they can have anxiety, they can develop psychosis, they can have sleep problems, feeding problems, so on and so forth. So all this is under the umbrella of what we call as behavioral and psychological symptoms of dementia, or BPSD for short. So this is quite common during the course of the illness, as much as up to 90% of people will have BPSD during the course of their illness at some point, and that is very challenging for the family to manage. So not only this, but they become very aggressive, very agitated, develop paranoid thoughts. They believe that the family is going to poison them, or they're mixing. They, instead of giving them the tablets, they are giving them poison, or people are stealing or breaking into the house. So all these are very difficult symptoms to manage. Then coming to another closely related condition called delirium, or acute confusional state, which closely resembles the symptoms of dementia, but it's a distinct disorder, and it starts very suddenly within matters of few minutes or few days, and it can resolve once the underlying cause is identified and treated. So let's look at some of the common causes of delirium. So delirium is more common in people who have dementia, some kind of dementia. So commonly a person with delirium, as I said, in the matter of few minutes to few days, they may become very aggressive. So there is change in their behavior, and there is fluctuation. So if a person has been having a normal period of, say, few minutes to few hours, and if you see that person after some time, they may be completely different. So the symptoms wax and wane, or they fluctuate in time. More so, these symptoms are worse after the sunset, or what we call as sundowning. So after, say, 4 or 5 o'clock, their behavior worsens. They may also have psychotic features like, as I said, the paranoid ideas, hallucinations, very classically or commonly visual hallucinations, so seeing things which are not there, or misinterpreting the stimuli. Say, for example, if they see a curtain hanging, they may feel that there are snakes on the walls. So these are very disturbing to them. Then the sleep is affected. There is reversal of the what we call as the sleep-wake cycle. So they may sleep during the day and be awake at night. And the common causes are urine infection, undiagnosed pain or too much of painkillers, chest infection, or any change in the medication. And people with dementia are more prone to this. Okay, so this is broadly about delirium and dementia. And what can be done? So let's look at that. What can be done to prevent or reduce the chance of developing dementia? Now, dementia can run in families, and fortunately that is very rare. So very minority of cases of dementias can run in the family, or they can be hereditary. What are the other factors? So the lifestyle, the environment, that plays a major role. People with certain mental illnesses are also prone to develop dementia later in life. So if you are suffering from any mental illness, get yourself checked and treated by your psychiatrist as the earliest opportunity. So there is a talk about healthy lifestyle or reducing excess amount of weight, having a healthy diet, good night's sleep, because nowadays there's lots of emphasis on the sleep, or the what we call as rapid eye movement sleep, when what what happens is the brain is sort of recharging its battery and all the memories are stored. So this is as good as charging a phone. You're backing up the phone, so it's similar. So you need to have a undisturbed refreshing sleep for at least 6 to 8 hours. Now everybody's sleep pattern is different. So people who have some conditions called as sleep apnea or obstructive sleep apnea, there is a link or an association between lots of other physical illnesses and also with dementia as well. Okay, so taking your blood pressure medication regularly and on time, getting yourself checked is important, because blood pressure itself is an independent risk factor for Alzheimer's and vascular as well, because if your blood pressure is not controlled, you may develop stroke and so on and so forth. Having a sugar-free diet or treating your diabetes in time and having a stringent control of the blood sugar is also important, because that's also a risk factor for Alzheimer's. So basically staying healthy, remaining stress-free, taking exercise regularly, not smoking, and drinking alcohol very sparingly. Now, patients ask us that, doctor, we read somewhere that if you drink alcohol within limits, that may reduce the risk of stroke or dementia. Now, there is some link, but we cannot sort of prescribe or advise a person to start drinking. So you should drink within limits as recommended. And another thing is alcohol will nullify the effects of some of the medication that you may be already taking. So consult your doctor and get advice from them. Okay, let's end the talk here, and I can be contacted. I practice at Global Hospital, and my own clinic is at Kem's Corner at Om Chambers, and I'm freely available, very easily approachable. Thanks very much. I'll be happy to answer your questions. Bye bye.